Hi, Dr. Moore here. We're going to talk about the lumbosacral plexus. I'm going to try to make this as simple as possible. There's a lot of nerves here, and we're going to just try to keep it simple so you can understand that. Lumbosacral plexus is from about T12 to S4. So it's about from here all the way down in through here. And so those nerves that come out from the spine, and you have T12 and L1, they come together and they make your ilioinguinal, iliohypogastric, kind of the area of the groin. That's what that controls into there. You have your genitofemoral nerve, L1, L2, and that is, again, the groin area. Then you have your psoas muscle. Now, the psoas is a very interesting muscle, the psoas nerve. That is on the front of your spine into the interior of your pelvis. It's in charge of bringing your leg up and out. And then you have your lateral femorocutaneous. So then on the outside of your knee is the lateral femorocutaneous nerve. Then you have your femoral nerve, L2, 3, 4, your femoral nerve and your obturator nerve. Your femoral nerve is going to be your iliacus, your sartorius. Your L4 saphenous nerves. L4 saphenous nerve is on the inside of your shin, kind of like the front of your shin and the side, and the inside where your legs come together. Then you have your rectus femoris, your vastus intermedialis, vastus medialis, and vastus lateralis. That's what actually makes your leg go forward like this when you walk. That's the kick in your leg. Then you have your obturator nerve, and that's in charge of your adductors. So as you walk, you want your legs to walk like this. Your adductors, adduction is here's your leg way out here, it comes into the center. Like that. That's your obturator nerve. There's your all the adductors in through there. Middle part of your and if you go to your quads and you go middle between your legs right in that area there. Then you have your quadratus femoris, which is L4, L5, S1. Your superior gluteal nerve, L4, L5, S1 also. And that is going to be for your tensor fasciae latae, your gluteus minimus, your gluteus medius, kind of like the external rotators of your hip and what makes your legs go out like this. So when you bring your leg out like that, that's going to be your superior gluteal nerve. Now your infield gluteal nerve, it's kind of funny because your infield gluteal nerve controls your gluteus maximus. The superior gluteal nerve controls your gluteus medius and minimus. I don't know how they name it that way, but they do. And your piriformis nerve comes off of S1 and S2, which is shared by your inferior gluteal nerve. Your piriformis is kind of in the middle of your buttocks from your sacrum to to your hip, and it's in charge of externally rotating your hips. Now, sciatic nerve. Everybody wants to know about the sciatic nerve. But sciatic nerve is from L4, L5, S1, S2, and S3. Now the sciatic nerve breaks into the common peroneal nerve and the tibial nerve. So it covers the whole front of your leg, foot coming in, foot going down, foot inverting, foot everting, a whole bunch of stuff. And then you have your pudendal nerve, which is S2, 3, 4. And I made this one brown. There's a saying in school, S2, 3, 4, poop hits the floor. If you have a hard time with your pudendal nerve, you will lose control. And sadly, I see that with people. And your pudendal nerve also is kind of like when you sit on a bicycle seat, that area that touches the bicycle seat on men and women, that's what that controls. So if you're having discomfort in that area, that's your pudendal nerve. That's way down into your sacrum. This is your lumbosacral plexus in a nutshell. Look for further videos where we talk about how we help people with problems. Sciatica. Sciatica is a lot different. Most people will say sciatica. I got sciatica on the front of my leg. Sciatica is not on the front of your leg. It will not be. That's not sciatica. That's more L5 nerve root. And so we'll go through some subsequent videos. We're going to talk about problems people have with the lumbosacral plexus and what we do to help that. But for now, I'm Dr. Robert Moore. Please like us on Facebook, subscribe to our YouTube channel. If you have any questions or comments you'd like to speak with me directly, please feel free to call our office directly, 810-225-7246. And as always, God bless you. Have an awesome day.